Today our guest is Iskra Reitz, Executive Vice President of AstraZeneca Europe and Canada. Good morning. We welcome you warmly from Karpacz, where the economic forum is held. I know that you are in Zug in Switzerland, which is not so far from here. But getting to the matter, I suppose there is no surprise if at the beginning I will ask you about anti-COVID vaccines. The pandemic has caused many people to associate AstraZeneca mainly with COVID-19 vaccine. With the benefit of hindsight and given the challenges that the pandemic has posed, would you, as a company, commit to the vaccine development efforts once more?
Hello, thanks for the question. Thanks for the invite, and good morning to everybody. I'm actually sorry that I'm not that I wasn't able to join you today, but happy to at least have an opportunity to talk to you. So let me start by saying that as a company, we are first of all extremely proud to have put an incredible amount of efforts to really stand up to the challenges that this pandemic brought to the societies worldwide. And even with all the burdens and the hurdles that we had to overcome, we will definitely do it again without hesitation. Because we believe that we did our utmost best to try to help the pandemic. And because we knew that our vaccine would, and actually already did, help to save tens of thousands of lives in Poland, in Europe, and across the globe. And we are very proud that together with the University of Oxford as our key partner in the vaccine development, we were really the only company that actually supplied the vaccine at the cost during the fall time of the pandemic. It's worth saying that no matter of all the efforts, as you mentioned, and the hurdles, we today are very proud when we look back and say that actually our vaccine represents an important solution worldwide to the pandemic, especially given the fact that we deliver 1.2 billion doses globally to date, and many of those doses actually delivered through the COVAX platform to the low and mid-income countries in more than actually 170 countries around the globe. And therefore, we are very proud saying that our vaccine is truly made for the world. I'm also happy to say, and I want to share that we also deliver 8.5 million doses of our vaccine to Poland, and I do believe that for Poland, our vaccine also represents an important part of the solution against the pandemic. But although, as you said, AstraZeneca is very much associated with the vaccine nowadays, I think it's important to say that this is not the only effort we put through in the pandemic, and we actually continuing to fight and see what are the additional solutions that we can bring, because we all know that additional approaches to both prevent and treat COVID-19 will be needed. And therefore, we actually expanded our COVID-19 portfolio, if you want, with a longer acting antibody combination that is actually meant to help and protect and give additional protection to the vulnerable population, specifically immunocompromised patients that we all know will need additional and more immediate protection than the one that vaccine can provide. And also, it's fair to say at the end that we are very proud that despite all of the efforts, we also managed in Poland and globally to really maintain our business continuity. And during the whole pandemic, we managed to deliver and ensure access to all the innovative medicines that are important for so many patients around the globe.
Okay, thank you very much for sharing with us your point of view. And now I would like to talk about a special project on building and developing sustainable and resilient healthcare system in which your company, but also our country, my country, is involved. The name of the project is Partnership for Health System Sustainability and Resilience, and AstraZeneca, along with the World Economic Forum and also with London School of Economics, are the initiators of the partnership of the project, which, according to the project's website, focuses on conducting research on country and international level with the goal of identifying transferable solutions with the greatest potential and supporting the adoption to deliver better health and better care all. For all. Can you say a little bit more about this project? Could you please explain why AstraZeneca, as a pharmaceutical company, devotes its resources and know-how to systemic initiative?
Yeah, happy to do so. Let me start by saying that in AstraZeneca, we truly believe that we have a responsibility as one of the key players, or critical player in the life science sector, to really invest in the strategic partnership that aim to build more resilient and sustainable healthcare system at the end to the benefit of the patients and the broader economy of society. And I want to address specifically the part of your question on the role of the pharmaceutical company in such a partnership. And I think that we always believed, and I think COVID-19 crisis really show us that very clearly, that if all stakeholders do not work together, and here I primarily think of the private and public sector, as we are trying to do in the spirit of the project that you just mentioned, it will be so much harder for all of us to build better healthcare systems for the future. And that should be a priority because it really impacts the long-term sustainability of our societies. And I think it was very clear, even in the beginning of the pandemic, that this crisis would definitely have a long-term impact on the healthcare systems around the globe. And we felt the urgency to do something in this kind of with this longer-term perspective. And this is actually how the idea of the PHSSR project actually started. So we approached the London School of Economics and World Economic Forum with this idea to create research, but also action platform with the many different stakeholders involved that will really help countries to kind of learn in real time from the crisis, to actually identify the key pain points of their healthcare system and then address it to the recommendations that this project was supposed to provide. And from the beginning, we were very keen to bring academia, public and private sector to really kind of work together on the science-based solutions and the tools that can be of help to the governments and other public stakeholders when managing the impact of the healthcare system during and after the crisis. And if I may go a bit more specifically and concretely what we were doing in the project, basically we launched the pilot phase where we included 8 countries around the globe, Poland being the one of them, where the country research teams, with the help of the London School of Economics, really deep dive into the key areas and the pain points of the healthcare system. And the partnership and the research basically managed to build a so-called blueprint for the areas that are really posing the biggest hurdle, if you want, to the public health. For example, chronic kidney disease, lung cancer, or chronic airway disease. And we are today, looking back, we are extremely proud to see the momentum that this project actually gained, the pilot phase, and also the engagement and excitement in the all 8 pilot countries. But we're equally very keen to see how we can expand it further, because we received many requests from many other countries to learn and be involved in the project. And therefore, currently we are working together with London School of Economics and World Economic Forum to actually bring more partners on board from private sector primarily to actually continue the work and make sure that we expand the project and its impact broader globally.
So we are talking about pilot stage and then engaging of Poland. So while talking about my country, what are you doing specifically in Poland around the project?
So, as I said, Poland was one of the 8 countries that were including in this pilot phase. And
can we name at least other countries? I remember
yes,
Germany, France.
Yes, there are a few countries in Europe, but it's not only Europe. I mean, yes, Germany, France, UK, but we also expanded because we wanted to see how the crisis impacted other places in the world. So, for example, countries in the Asia were also involved. So we really try to kind of look at the issue globally and see how we can make sure that the learnings we get are actually applicable not only for Europe but also to other countries. From the Central
Vietnam, if I am not mistaken.
Vietnam
Yes?
was involved. Vietnam was involved. Yes, that you're absolutely correct. So basically, if I go back to Poland, saying that Poland was the only country that was involved in the pilot from the Central Eastern European region, together with the countries like Germany, France, and UK, as you just fairly mentioned, the Polish research team work hard to really identify the key recommendations to address the critical issues of the healthcare system. And if I name few, it was around the governance, financing, workforce, and use of technology. And these findings really included a few very important recommendations. One going towards importance of strengthening the skill mix among the medical employees, the consolidation and importance of the long-term and chronic disease care, which is very important, especially in the crisis where you had the patients who are not able to access the healthcare system. But then equally important to expand and see how the technology and e-health tools, so-called, can actually help to improve the patient care with a specific focus on the remote care that was one of the probably key learnings during the crisis as being so important to ensure sustainable ability of the healthcare system to actually address the chronic disease burdens of the patient. And although Poland was the one of the pilot countries and we finalized this initial work, that doesn't mean the work is done. So the experts and the research team in Poland is actually continuing their work, making sure that now they will develop the tools that can be actually used to improve these pain point areas that were identified through the project.
Okay, so as I understand, Polish experts still are working, but what factors contributed to your decision to include Poland on the short list for the pilot phase of your project?
Well, there are a number of reasons. I mean, first and probably most important is that Poland is definitely a strategic partner and a strategic market for AstraZeneca. And I think that's very clearly demonstrated by our 30 years old footprint in Poland, in our Warsaw site, which, by the way, was just recently granted the status of the R&D center second time in the row. In that Warsaw site, we actually currently employing 2,300 highly skilled and talented employees that work around different functions in AstraZeneca, for example, clinical development, innovation, commercial, or medical. The second reason why it was very clear for us that Poland should be one of the pilot markets is our ambition and lot of work that happened in the last few years to be a partner of choice, if you want, to the Polish government. And we really appreciate and we are very pleased to see the openness of the public stakeholders to drive the initiative like this one to really put the academia, public and private sector together to improve and make Polish healthcare system even more innovative or even more sustainable for the
So if I may interrupt, it's kind of public partnership.
Sorry, can you say it again?
So if I understand correctly, it's kind of a public partnership, public-private partnership.
Public-private partnership, exactly. And to be fair, it's not only PHSSR project that actually demonstrate that openness of the Polish government and also other stakeholders in Poland. I was very happy and pleased when I was recently in June in Warsaw when together with the partners and we launched the project of the new interesting initiative, which is Warsaw Innovation Hub. That was the project led by Medical Research Agency. And this is another example how the government and the public stakeholders can actually build help the platform where different private partners and academia can work together to identify the new innovative solution that can actually help to improve the patient outcome and hopefully in the long-term run helps to make the healthcare system more sustainable, if you want. But there is also, if I may say, there is also a third reason why Poland was an obvious choice for us, and this is because we really believe that this is a pioneer initiative that can actually help and inspire other countries within the, for example, within the Central Eastern European region. So we do see Poland leading that way and also helping to really maximize the opportunity that we believe you can see in each and every country in the region, and this is to further improve and strengthen the patient care and further add, if you want, the innovativeness of the healthcare system and drive the resilience and sustainability that seems to be so important as we all witnessed during the crisis.
So it's kind of form of encouragement for our neighbors.
I hope so.
You hope so, okay. Madam President, so to summarize, can we say that the partnership, now fully name again, a partnership for health system sustainability and resilience, is at least partly answer for current pandemic and chance for better preparation for next similar health crisis?
Absolutely. That was the key idea and the key objective of the project, how we can really see, how we can really identify the areas that can help us to make the healthcare system resilient for any new crisis that may come. But equally, and probably even more importantly, how we can learn from this crisis to make healthcare system sustainable, no matter if we will need to fight another crisis or not.
Okay, Madam President, thank you very much. I will say again that our special guest talking from Switzerland was Iskra Reitz, Executive Vice President of AstraZeneca Europe and Canada. Thanks a lot. Thank you very much.
Thank you very much. Have a good day.